You know, there's one Medicare plan that most people will never tell you about. YouTubers normally don't want to tell you about it because it pays the lowest commissions. And the plan I'm talking about is the Medicare Supplement High Deductible Plan G. And here's how it works. The High Deductible Plan G is a Medicare Supplement Plan G, but with a high deductible. The deductible is $2,870 in 2025. Once you spend $2,870 out of pocket, the high deductible covers everything after that. So today, let's look at 5 facts about the High Deductible Plan G, and I'm going to show you how it works, how it compares with other plans, and then maybe you can figure out whether or not a High Deductible Plan G is a good choice for you. Okay, first, the High Deductible Plan G has a much lower premium than traditional plans G and N. And this is one of the main selling points of the High Deductible Plan G. It just costs much, much less than the Supplement G and N. So just to give you an idea, here is a chart with some real numbers from the lowest cost plans in several different cities. I'm going to show you the Plan N, the G, and the High Deductible G side by side. Now for this chart, I've taken the age of 65. So this is the lowest cost for a 65-year-old. If you're older than this, then it's going to cost more in most places because in most states, the premium is set based on your age. But in Los Angeles, California, the lowest cost Plan N is $114. The lowest G is $148, but the lowest high deductible G is $37. Now again, this is for a 65-year-old. In Texas, $95 for an N, $124 for a G, but only $35 for a high deductible Plan G. You look at Miami, New York, now New York, $260, $325, but $68 for the high deductible G. And then Philadelphia, $103, $126, but only $34 for the high deductible Plan G. Now let me start by saying if you're someone with no health issues, then choosing a high deductible Plan G can save you a lot of money over other plans, particularly over a Plan G or a Plan N, the traditional Plan G and N. And that's money that you've saved that you can use for a Part D prescription drug plan or for dental, hearing, and vision insurance, or for other things that Medicare is not covering. The next thing you need to know is how a high deductible Plan G has a fixed spending limit. In 2025, that is $2,870. That's your fixed spending limit. Now, once you have spent $2,870 out of pocket, your plan will take over and you don't have to spend anything else for the rest of the year on your medical needs. Of course, remember, your drug plan is separate. Now, this is quite a bit different from how a traditional Plan G works. Remember, with the traditional Plan G, original Medicare pays first, then they pass your bill onto the Plan G. If you have already paid your $257 annual deductible, then the Plan G covers everything else, and by the time it comes to you, there's no bill left. But with a high deductible Plan G, it's different. Original Medicare pays first, then they pass the bill to you. It goes through your insurance company to make sure that you haven't hit your deductible yet, but you have to pay everything until you've reached $2,870. Now, this is the same for all high deductible plans. So if you have a high deductible Plan G, no matter which insurance company it's from, it's going to have a deductible of $2,870. And now once you have spent that $2,870 plus your $257 Part B deductible, now you're going to have your insurance company take over and they're going to pay everything out of pocket. So that's how a high deductible Plan G is different. You're going to pay the $257 Part B deductible, then you're going to pay the first $2,870 in copays, and then after that, your high deductible Plan G will cover everything after that. Now, $2,870 plus $257 sounds like a lot more than just the $257 that you'd have to pay under a traditional Plan G. But take a look at this chart, and I'm going to show you how the premiums versus the out-of-pocket expenses are for both plans. As you can see here, a traditional Plan G costs roughly $150 a month for a 65-year-old, or $1,800 a year in premiums alone. Now, in some states, it will be higher than others. In some states, it's lower, but $150 a month is roughly our national average that we're going to work from here. Now, no matter how many times you go to the hospital or that you see a doctor or have a surgery, if you have the Plan G, the most you'll have to spend out of pocket is $257 for health services. And that means that the most that you would spend in this example is $2,057. That's $257 plus $1,800 in premiums. So I'm combining your premiums plus what you would have to spend. Now, always remember that this maximum out of pocket does not include your drug costs. Drug costs that aren't things that are delivered in a doctor's office, that don't fall under Part B. So drug costs, meaning drugs that you fill at the pharmacy, they're always going to be covered separately. But for all of your health services, that would be your maximum, your premium plus the Part B deductible. Now, the average cost for a high deductible Plan G is roughly only $35 a month for someone who's 65. So it's significantly less than the Plan G. That ends up being about $420 a year. But if you go to the hospital a lot and you need a lot of visits to the doctor's office or a lot of surgeries or or you're going through chemotherapy or something like that, you're going to have to pay your $257 Part B deductible. Then you're going to have to pay the first copays up to $2,870. Remember, you also had $420 a year for your premium. All of that adds up to $3,547. So here's what this means. If you rarely or never see the doctor every year, you could potentially save a lot of money with the High Deductible Plan G. In fact, even if you go to the doctor a lot and you end up spending $1,500 out of pocket, you'll still be paying less than the High Deductible Plan G on average compared to a traditional Plan G. And if you have 2 or 3 years where you're just completely healthy and you never visit a doctor, your savings will really stack up with a High Deductible Plan G. So in the year that you do need a lot of services and you do max out your plan, over the course of 3 years, you're still saving money. So in a nutshell, people who prefer to pay more upfront to have lower risk, they usually go with the traditional Plan G. While people who prefer to pay less upfront and are okay having to pay when they see the doctor and maybe taking a little bit of risk, but realize that they're paying a lot less in premium, they go with the High Deductible Plan G. Now, there's one other point I want to make in this section that's really important that you understand. When I say that you're paying a deductible of $2,870 with your High Deductible Plan G, that doesn't mean you're paying all of the costs. Remember that Medicare is still picking up 80% under Part B, and a lot under Part A too. Of course, it's not exactly the 80-20, it works differently, but the point is that Medicare is still picking up their part. So if you have a $100,000 bill, you're responsible for 20%. Well, you would have to pay $2,870, and then your Plan G would pay the rest. But if you're going to the doctor visit, a doctor visit is maybe $150, $200 bill to Medicare, something like that. If it's a $200 doctor visit, then your portion is $40. Because Medicare is covering 80%. And so only $40 is what you have to pay that counts towards your $2,870. Can you see how hard it is to hit your maximum out of pocket on a Plan G? It's only true if you're having major issues, if you're having many visits, if you're having lots of visits to the hospital, if you're having chemotherapy. Even a surgery is not going to cost, in most cases, anywhere near the $50,000 it takes for you to hit that maximum out of pocket. So for a lot of people, a Plan G, High Deductible Plan G, can save them money. Okay, my third point here is let's take the High Deductible G and compare it with a Medicare Advantage plan that has a maximum out of pocket. Medicare Advantage maximums per year depend on where you live, but in most cases, generally, let's say that they're $3,000 to $4,000 range. So in that regard, they actually have similar maximum out of pockets. However, there are major differences between the High Deductible Plan G and a Medicare Advantage plan because the High Deductible G is still a Medicare Supplement plan. So let's look at the differences here. The High Deductible G has no network. It doesn't require prior authorizations or referrals. It does not have built-in prescription drug plan. It doesn't have perks or extra benefits. And there is no need to renew it, during annual enrollment period. You don't need to look at a new plan. You just look and see what your premiums are. With the Medicare Advantage plan, yes, they typically do have networks. Yes, they typically require referrals and prior authorizations. Typically, they do have prescription drug plan built in, especially if it's an MAPD, Medicare Advantage prescription drug plan. They typically have perks like dental, vision, and hearing and other benefits, but they do renew on an annual basis, and they will renew automatically, but you need to check them every year because they can change every year. Okay, for my fourth point, you might be curious and wondering, will the deductible of $2,870 stay the same indefinitely? Well, the short answer is no. Every year, Medicare adjusts the deductible amount to inflation. This is similar to how the cost of living increase happens with Social Security. So here's how much the deductible has gone up in previous years. You can see all the way back in 2020, the deductible was $2,340. Well, it's gone all the way up to $2,870 in 2025. So the deductible will go up over time, and the premiums also will probably go up every year. So this means that as you get older, the cost of a High Deductible Plan G is going to rise dramatically, both in deductibles and premiums. So while the first year costs may look tempting, remember that both the deductible and the premium can climb significantly over the years and over the long run. So that's especially an important point to keep in mind if you're looking at it and saying, oh, I'm going to join like this and it's always going to be like this. No, it's not. It's always going to go up. Every cost in healthcare has always gone up, and that's just going to be the case here too. Okay, the fifth and final fact is that it's not easy always to move from a High Deductible Plan G to other Medicare supplements. It can be difficult later on. Now, we've known several people who said, oh, I'm going to take the High Deductible Plan G when I'm young, and as I age and I start to have more issues, then I'm just going to switch over to the regular Plan G. Well, it doesn't always work that way. You can move from a High Deductible Plan G to a Medicare Advantage plan during annual election period, and some other times too, without any issue. But if you want to go from a High deductible plan G to a regular plan G, you might have to go through medical underwriting. You might have to answer medical questions. And if you have had issues in the past couple of years, if you've been hospitalized, if you've had a heart attack, if you've had cancer, if something major has happened to you, then the insurance company might say, no, we're not going to take you. Now, they can't cancel your high deductible plan G. They have to keep you where you are, but they might not allow you to move to one of their other plans. And that's the same for other insurance companies too. You say, well, I'm frustrated with my insurance company. I'm in the high deductible plan G. I don't want to be. I want to move to something else. So I'm going to move to another insurance company. Well, the other insurance company is going to do the same things. They're going to ask you medical questions. And some people try to sneak by and just say, well, I'm just going to lie. I'll just say I wasn't hospitalized. Well, listen. Your medical records are not that difficult for the Medicare Supplement company to find, because one of the ways they can do this is that they will look up your medication history, and it doesn't lie. They know the prescriptions that you filled at the pharmacy, right? So it may be difficult to switch later on. And so when you go into a high deductible plan G, you have to go in with the understanding that there's a possibility this may be my long-term plan. I may not be able to change later on. So what do these questions look like? Well, here are some questions from an example application that talk about health conditions and ask you questions. And if you say yes to any of these, they may reject your application. And that's why it might not be a wise choice to choose a high deductible plan G if your intent is to go to another plan later on. So you need to do all the calculations now and figure out, is it worth it to stay with it for the long run? Okay, so let's recap the pros and cons. On the pro side, number one, clearly defined maximum out of pocket, noticeably lower premiums than a traditional Plan G and Plan N, and number three, fewer restrictions than a Medicare Advantage plan. For example, you have nationwide coverage. Now on the con side, bigger upfront payments than a traditional Plan G. You have those deductibles. Inflation and premium increases may make it more expensive as you get older, and those are the two primary cons. So with all of this, let's ask the big question. Should you consider enrolling in a high deductible plan G? Well, if you're someone who wants to save money on premiums, you're currently pretty healthy, and you bet that you're going to stay that way for quite a while, you're okay paying more when you get sick or when you go to the hospital, and you don't want to deal with networks, prior authorizations, or potential downsides of a Medicare Advantage plan, then a high deductible plan G might be the right fit for you. But always keep in mind that a high deductible plan G can cost you a lot more than a traditional plan G if you're hospitalized or you see the doctors a lot. It has far fewer perks than a Medicare Advantage plan. It doesn't have prescription drug coverage. It doesn't have benefits for dental, vision, and hearing, or gym memberships, or some of those other things that come with the Medicare Advantage plan. So if you want to make an informed decision about this, the next step for you would be to find out how much a high deductible plan G will cost in your area. You can contact us here at PlanFit to find out how much a high deductible plan G costs in your area. We look at every available plan and make sure that we're showing you the lowest cost, but also recommending insurance companies that have reputable and long-standing histories. And the other thing that you can do is watch one of my brutally honest reviews of the Medicare Supplement Plan G or the Plan N, which are in my other videos.